All right, so we got a question emailed in from Lily. She emailed us at questions@askjoedimatteo.com. You can do the same. Lily said, could you please discuss ulcerative colitis in young kids? Mine is 12. I'm very excited about the new podcast, and I'm waiting with bated breath. Well, don't wait. Breathe, please. Mm-hmm. We don't want you to pass out. Ulcerative colitis in young kids. Ulcerative colitis isn't that an old person's disease?
Yeah, so the peak age onset of ulcerative colitis is anywhere from 30 to 40 years old.
Okay.
But it ultimately can occur at any age. Okay. So 15 to 30 is common. There's still, a large percentage of adults that get it after 60 years old. It can happen throughout the lifespan.
Yeah, 25% do contract it during childhood. 25%.
Wow. Okay, so for folks that don't know, what is ulcerative colitis?
Yeah, so it's under the umbrella of the inflammatory bowel disease.
Okay.
And so there's multiple diseases within that. Crohn's and ulcerative colitis are sort of the big two, or at least the two that are most tightly related.
Okay.
The classic difference with colitis is that it's dealing with inflammation and mucosal damage to the colon and rectum, so your large intestine.
Got it.
The difference with Crohn's is that it can ultimately affect any part of your GI tract. And so, in a very rudimentary way, ulcerative colitis just encompasses the changes that happen to the large intestine specifically.
Okay.
So lower in the GI tract, sometimes individuals, they only have issues with proctitis or like inflammation of the rectum and such. So you just kind of think of it as lower in the GI tract.
Okay.
And the inflammation doesn't span through like all layers of the intestine. It stays again more towards that internal mucosa.
So close to where your food is and is processing. Yep. Okay. And so what is it? So it's an inflammation of the mucosal there. What does that feel like? What does that mean functionally?
Yeah. We've talked a little bit about IBS and such and other GI issues. So a lot of the symptoms that you'll see will mimic a lot of those other GI conditions.
Okay.
Some of the distinguishing features are just extended periods or frequent bouts of diarrhea, the classic abdominal pain and cramping. There's some systemic symptoms. You'll see fever, weight loss.
Wow.
Bloody stools is, often a giveaway as well. And then as far as classification goes, they'll just break down some of those symptoms more and say, this person has had 10 or more, bloody stools per week or per month. And then that's how you begin to, the clinician will begin to parse out what kind of tests do we need to run? Do we need to look at stool samples? What's present in the stool? All those sorts of things.
Okay. So if this is happening to somebody that's 12 years old, that's rough.
It is. Yeah.
Man, oh man.
And that's a huge part of this, as the clinician, if you're dealing with pediatric patients, part of this is going to be the educational process of, hey, this is kind of going to be a lifelong thing that you're going to have to manage. You're going to be learning along the way. It's not going to be easy. We're going to be striving for periods of remission, although we're not going to be able to maybe get you fully better, so to speak.
Right.
We're shooting for, and we're trying to find the treatments and the changes that help you achieve the longest periods of remission, or the longest periods of, ultimately where you don't have a flare up.
So there is no cure.
Right.
We're not going to fix this.
And maybe that's not the best thing you say to a 12-year-old, so I apologize. But again, that's just part of the educational process. I think.
But this is the truth. If you don't want to lie to the kid, if there's no cure, what you're going to need to do is to learn how to manage this and reduce the flares.
Yes.
Okay.
It's a flare-based disease.
Okay. So how do you manage flares? Mm-hmm. How do you do that, especially at 12?
Even if we backpedal even slightly, one of the big components, or one of the causes they think of colitis and Crohn's and the inflammatory bowel diseases, is the autoimmune component. So you have infiltration of certain white blood cells, lymphocytes, plasma cells, macrophages, all these fancy names, all these things that typically have good function, in the system, that are ultimately on overdrive.
Okay.
And so then with treatment, which how you sort of drive treatment or how they've come up with different treatment options is you want to sort of combat that autoimmune component. So they'll often use steroids, they'll use, other anti-inflammatories, and, we can break some of those down further, but just even taking a, further step back, just looking at where this all kind of comes from. There's even a genetic component.
Oh, wow.
There's obviously environmental sort of implications. And, I thought this was very interesting. Smoking for the most part is almost always a negative in terms of any health outcome or any disease state. They actually found that nicotine was something that potentially helped individuals with ulcerative colitis specifically.
No kidding.
So if you're on Wikipedia, you might see that and you might get a little spooked. We're not recommending that you smoke or start using nicotine patches, but it is just a fun fact, if you will, if you're ever playing inflammatory bowel disease trivia, nicotine might have some benefit. So, but yeah, we're not recommending nicotine use.
Do not smoke.
Yeah,
do not smoke.
Not. And then Joey, I don't know if you had anything in that regard to add.
In terms of the treatments, unfortunately, there's not a whole lot of difference between children and adults.
Okay.
And they're heavy hitters. It is steroids, it is medications that, especially during the flares, that do, even if you're going a little farther down the line, things that do alter the immune system, that are immunomodulators, DMARDs, disease-modifying anti-rheumatic drugs. So, you do go into some heavy hitters.
Yeah.
And I say this kind of sheepishly because I wish that there was maybe a version or a milder version of treatment for kids. So there's just, unfortunately, right now, really not. And that it involves the steroids. And then some people even stay on steroids, and to prevent remission, lower doses, something like budesonide that kind of stays in the gut and is used for, a little more, not as systemic as something like a prednisone. But definitely, there's definitely a role of flora. This is not a probiotics cure. You see here, but flora plays a massive role, and even your body's response to the flora. From this article here that I pulled, I thought was very interesting. I lost exactly where it was, but yeah, Emory Children's Center in Atlanta, Georgia, Division of Pediatric Gastroenterology. Right in their beginning, their abstract, it says IBD, of which UC and Crohn's are the two, is thought to develop as a result of dysregulation of the immune system's response to normal gut flora. So in a genetically susceptible host. So even it's the body's response to your gut flora.
Right.
So if there's something, if you've got, what we term dysbiosis, history of antibiotic use or history of food poisoning, like we talked about before, you've got this kind of underlying SIBO growing dysbiosis in your gut. Your body's immune response to that potentially can have something to do with that as well.
Okay.
So I think probiotics are huge. Understanding your history of antibiotic use is big. Anti-inflammatories like curcumin have shown to have some benefit. So there are things you can do in that regard, but in the traditional medicine realm, and if you're dealing with flares, you typically have got to stay in that world, so to say.
Yeah, and then even just to kind of help put some of that into a more global perspective. So Joey covered a lot of important parts there, but even if we back up, we look at this in maybe 5 categories, let's just say, as far as how this often gets treated. And I would be remiss not to at least kind of mention them more, stepwise. So obviously mention medications. Surgery, I think, is important to mention. Number 2.
Oh, wow.
I saw a statistic that upwards of 50% of patients with irritable bowel disease unfortunately end up having surgery of some kind, some sort of bowel resection, something along those lines. And that's just because of ultimately, as the disease process explains, there's that continual inflammatory ups and downs that are kind of damaging the mucosa.
Okay.
And so eventually you have some tissue that might need removed, and it's not easy. That's just one of the the sad realities of this.
Yeah.
They have improved some of the surgical procedures that they're doing now. So before, the surgeries were, and they still can be, very invasive, almost always end up with the, colostomy bag or wherever the resection ends up, which many people manage
Yep.
to live that way, which we commend. I mean, that would be immensely difficult. So medication, surgery, Joey mentioned some supplementation, obviously probiotics, curcumin, which we can talk about is a good one. There's going to be dietary changes.
I was going to ask about that.
Yeah, as one might imply, just given the the nature of the condition, because your main goal is to reduce the severity of the flare-ups and also the frequency.
Yeah.
How do you do that? You're gonna have to make some lifestyle adjustments and
Okay, what are
recognize
those?
some things. Sure.
Quickly, I mean, you don't have
yeah.
to go deep into it, but what are the
Yeah.
high
And
points?
These will come as no surprise. You want to limit the intake of red meats, processed foods, things that can be kind of inherently inflammatory.
Flaming.
That's a little what's the word I'm looking for? A little controversial, the whole red meat thing.
Yeah, I was going to
Don't
say,
wanna-
is red meat's inflammatory?
Yeah, it definitely can be. And again, you just got to keep some of this in context. It's comes down to the amount that you're consuming for a lot of individuals.
I imagine
you
some
know.
people that would be a try it and see kind of thing.
Mm-hmm.
Get in a stable position where you're not having a flare up.
Yeah.
Try some red meat and see if it.
And if I had to,
Triggers.
hedge my bet there too, I would say that we're more focused on, as always, just trying to decrease the amount of processed meats.
Yeah.
So that's a big one. I one of the recommendations that I read was potentially decreasing protein intake. High protein intakes, it can just be irritating to the GI tract potentially. That's another thing that potentially you have to play with. Alcoholic beverages, sulfur, sulfates, they've all been associated with with disease exacerbations.
What about
And then
fiber?
Definitely a good one.
Lots of
that's something that
keep things going.
Sensibly, fiber, for 101 reasons is useful. In this case, yes, it's important, but I think the devil's in the dose there too. Because if you're somebody that has had 8 stools per week that were blood containing and they were irritating and it was stressful and you're inflamed and all that sort of stuff.
Yeah.
Increasing fiber intake, increasing the frequency at which you go can be a little bit of it's going to be take some trial and error.
Yeah,
Got
so I
it.
think the key with fiber, acute stages, lower your fiber. Not you're not non-acute, you're in remission.
Right.
Up the fiber, keep your colon healthy.
Yeah.
Got it.
And that doesn't mean like you stop eating fruit. And you
Definitely.
stop, but if you're somebody who is supplementing with
Just-
fiber, if
yeah.
you're somebody who ate 342 grams of oatmeal a day, like that
Right,
kind of stuff, like
right.
maybe consider scaling that back.
And something to be aware of and manage
Yeah,
yourself
exactly.
as you go on. Yeah.
Got it.
I think it's just another, it's a disease process where there's a million pieces of the pie and you're just trying to find which ones that can help,
Right.
can help you best through a flare up, let's say. And then the other thing, not to cut you off,
Nope.
the other thing, since we're specifically maybe looking at more of a pediatric population, I saw the recommendation to try and monitor the DEXA scan or a DEXA scan reading, which looks at bone density.
Okay.
And so this is an interesting tie-in. If you're 12 years old, you're still developing. Your bones or your bone density, the mineralization, all of that
Yeah.
stuff is still in a very critical point, I would say,
Absolutely.
because your ability to maybe absorb nutrients can be impaired from having something like this, or because maybe you're just unable to eat as much. Flares are more recurrent. It's just, you can see how this would cause issues with appetite,
100%.
weight loss, malnourishment. The key is in ensuring in the times where you're maybe feeling better to make sure you're eating a very nutrient rich diet. These things will help ultimately with bone mineral density. You might have to supplement with some calcium and some vitamin D if they find out that you're deficient, but to target that a little more, my bias of course is to ensure that you're resistance training. And so if you're somebody that has an early diagnosis of Crohn's, colitis, whatever the case, you might be a little more susceptible to these bone mineral density issues. Plus, which we'll highlight maybe a little more in the treatment section, you're probably going to be on corticosteroids for your flare-ups. Also can lower bone mineral density, even at low doses, at kind of infrequent uses. It can happen, especially then if you have 5 flare-ups a year. Those are all instances of being on steroids quite
Right,
often to keep
yeah.
that at bay. those are just all kind of pieces of the puzzle that can decrease your capacity
that's a
to
huge point.
maintain strong bones, especially in a 12-year-old.
I was gonna say,
you know, if you're 50, 60, it's still equally important, but especially in a growing human being, you want to make sure that the diet, nourishing diet, resistance training, building, axial loading of the skeleton, all of that sort of stuff is critically important.
Right, because resistance training directly increases bone density growth. Makes
It's
Kind of
sense.
the best, I would say, the best way to do it. So
That's
counteracting what those steroids are going to do.
Yeah.
And anytime deal with anything that's got a autoimmune link, vitamin D is core. So I would want to make sure, again, this is not the vitamin D cures colitis. This is, you're trying to do what you can do to minimize issues. If you've got a low vitamin D level, and vitamin D is that immune modulator, that you've got to check your level, see where you are, and look at getting on some vitamin D. Another thing that has shown to have benefits in large scale across the board is low dose naltrexone. The dose, it's safe in kids. The dose can be dramatically, customized in a compounding pharmacy. Low dose naltrexone for irritable bowel disease and really any any autoimmune disease has been shown to have fantastic effect. So
Okay.
that is something I would 100% look into at its core, with autoimmune D, LDN, and as a broad anti-inflammatory, like we brought up before, turmeric.
Okay, cool.
yeah.
That's cool. I'm glad we can help somebody out like that. Anything else?
So just for my man here with the question, his mom, I guess, you know, just to maybe highlight some of the questions they've asked him or asked them. They're always going to kind of be screening and assessing his symptoms. And ultimately, again, those are the kind of things that are going to monitor disease progression. It's going to monitor if the treatment's working. So there's a questionnaire. It's the Pediatric Ulcerative Colitis Activity Index. And so that's a sequence of questions that they'll often use to just, again, if you've just been diagnosed, they'll ask these questions. If you've just started a new treatment, they're going to ask this kind of battery of questions. Not immensely useful as the layperson to kind of know and memorize what those are. But again, it's a very active the point is it's a very active management process. There's going to be a lot of conversation with your, GI physician and such. And so just important to kind of know maybe why they're asking those questions. So the specific medication and the specific treatments that they'll use kind of comes back to this idea of disease location. So we mentioned a lot of medications that could have side effects. Let's just say somebody has a more distal form of colitis. So that just means that where they've determined through biopsy or through scoping or however, where they've seen the most amounts of inflammation to occur is more distally towards the rectum. That's
Got it.
Towards the end of the tract, more distal. They will often they'll use the same kind of medications. They're they're aminosalicylates.
Ooh.
And so they can use them orally and they can use them topically, and not in the sense that, you're going to rub it on your skin, but they might use it as a suppository.
Okay.
They might use it as an enema. And so
great.
just by default, you're going to be absorbing less. And so, some people might like to hear, "Oh, I'm not absorbing as much of this. I'm just using it's a distal form of colitis. This is just maybe a more easier way to classify this as mild disease progression." And then again, they're looking at stool frequency, stool quality, and the presence of systemic illness. So if you present with fever, God forbid, all the time, and there's all types of those, again, as the name implies, systemic effects.
Yeah.
You might be more apt to be prescribed one of the oral versions of those medications.
Okay.
So, and then like Joey said, there's immunomodulators, a whole host of things, quite complicated to get into. And then I think I want to go back to the curcumin thing, which is huge.
Yeah.
It's most useful in maintaining remission. So theoretically, if you're in a flare-up, this is something they may not want you to start. It may not hurt, but this could be something to help buy you some time in between flare-ups. And so depending on which form you're using, you can use up to 4 grams a day for induction and up to 2 grams per day during like a maintenance phase
Okay.
of colitis. And so this is generally safe in kids as well.